Good morning, everyone, to the Monday, November 8th media briefing. We'll get started with our CEO, Nicole Dupree.
Good morning, everyone, and thank you for joining us. There's no question that the COVID-19 pandemic has affected our day-to-day lives in a multitude of ways, including how we eat and what we eat. There's a clear link between healthy eating habits and lifelong health. Locally, only approximately 34.9% of Windsor and Essex County residents have reported consuming vegetables and fruit 5 or more times a day, which we use as a key indicator of healthy eating. Additionally, residents who are single, separated, divorced, or widowed report less fruit and vegetable consumption compared to married or common law residents. In 2009, our nutritious food basket calculated that it costs $211.20 per week to feed a family of 4. Due to the pandemic, we have not been able to update this number for 2021, but we know that the cost of food has increased considerably, and this burden has only gotten greater. Not only has price affected the ability to purchase food for some, but also the global supply chain has made some food items unavailable for lengthy periods of time. This has created an environment where our community members have had to be creative to find ways to feed themselves and their families. Considering that the COVID-19 pandemic has further highlighted the need for basic food skills, such as purchasing, preparation, and cooking, which are essential for healthy eating, the WeChew, in order to support healthy eating and food skills, the WeChew developed the You Can Cook virtual food skills program. The You Can Cook program allows for food skill education from the comfort of your own home in 5 minutes or less. There are 15 5-minute videos within the series, which are released every other Wednesday. Our series of videos, developed and led by one of our nutritionists, started in September of this year and will take us into Nutrition Month, which is March of 2022. The You Can Cook videos can be viewed on our WeChew YouTube page or on our webpage at www.wechu.org/YouCanCook. Through our You Can Cook program, our goal is to support our community in making affordable, healthy food choices while also increasing their food skills, self-efficacy for cooking, and confidence in the kitchen. If you understand where your food comes from and how to make healthy choices, you will be able to establish lifelong healthy food practices. Becoming more food literate means we are feeding our families with healthy food, supporting our local agriculture communities, and helping to grow our economy by supporting the industry that produces our food. Over the past few years, this has never been more important as we're in the pandemic and certainly spending more time in our homes. Thank you, and we'll take questions.
Thank you, Nicole. Today we'll start with Blackburn.
Sorry, I came in a little bit late, so I'm not going to ask any questions at this time.
Okay. We'll now go to the Windsor Star.
Yes, good morning, Doctor. Good morning, Nicole. Nicole, can you speak about some of the programs, some of the work that the Health Unit normally does to track how Windsor-Essex residents are eating healthy, how healthy they are eating, programs that may have had to be put on hold during the pandemic?
Yeah, thanks, Taylor. Good question. So we have a lot of programs related to healthy eating and nutrition and food skills that we would normally be supporting at the Health Unit. We have a number of registered dietitians and nutritionists who work across the lifespan within our organization in schools and workplaces, in the broader community with daycares. So some of the programs, we review menus, we provide advice and instruction on menus for, healthy child development. As well, as I mentioned, we do calculate the nutritious food basket normally, as other health units do as well. And this just provides an indicator of what the cost of food is locally, and we compare that to some of the, average income for our area as well. We haven't calculated that cost due to the pandemic. It does require our team to go out into a number of grocery stores, and we literally pull products off the shelf and calculate the cost. So hopefully we'll have that updated soon. We also work certainly with our food banks and all of our community partners around food security, food insecurity, data and monitoring. And some of that has continued throughout the pandemic, wherever possible, when we were able to deploy people back to their areas, when we've had maybe slower times with case and contact and less cases, we've prioritize food and food security and nutrition certainly. So some work has continued. The You Can Cook videos are a really good example of something that happened during the pandemic, was a priority, we know is a priority, and we really want to support education and healthy eating for folks in our community.
Thank you for that. And separately, somebody brought to my attention that the health unit's interval of 6 months between second and third doses doesn't correlate with exactly with the provincial recommendation of precisely 168 days or more. And the difference between what the health unit and locally what we're doing and what the provincial recommendation is can be about 16 additional days of waiting. Are you aware of this? And is the health unit looking to change from blanket 6-month interval to the 168-day recommendation from the province? Sorry, Nicole, you're muted.
Oh, thank you. The provincial guidance speaks to 6 months. It provides 168 days in the guidance as a sort of a average measure of what 6 months is, recognizing that not all months are the same length. We are discussing internally, but right now we're at 6 months. But the 168 days that's listed in brackets in the provincial guidance, it's not mandated 168 days. It's just to provide a generality around what 6 months is in days.
Okay. Sorry, go ahead.
Yeah, if I could supplement this, medicine is about judgment and making rational decisions. People who have received 2 doses of vaccine are well protected from COVID-19, and their risk of actually developing COVID-19 is reduced. So typically when we vaccinate people, we give a range. We give the optimal number and we give a range. And I would be more emphasizing the fact that people should get their booster shot if they're currently eligible for the booster shot. It's not something that's a clinical emergency per se, but it's something they should put on the calendar and get done when they become eligible for it. The clinical difference between 168 days and 180 days is not all that substantive. We'll try to implement policies so that we can have an organized rollout of vaccine. But I would emphasize that it's particularly important that people recognize that if they have 2 doses of the vaccine, they are protected from COVID-19. The more important priority right now is making sure that people who don't have any vaccine get their first and second doses. And that's one of the core messages we'd have at the Public Health Service, is that there are still perhaps more than 50,000 people in the health district who are eligible for vaccine who have yet not received the vaccine. And those individuals are unprotected. I think as a community and as a health service, we have to really work to reach out to those people in these next few weeks. So sorry for that long-winded response, but I hope that provides some additional context.
Yes, thank you, doctor. It answered my second question without me asking it. So thank you very much.
Any questions from AM 800?
Good morning, Doctor. Just in regards to the border, I know we touched on this briefly last week, but once again, your message to the public if they're planning to cross one of the border crossings.
Sure. So the border is managed by the federal Customs and Border Security Authority, and if they aren't planning to travel, they should follow the guidance and advice of the federal authorities related to that. At the health district level, we're focused on the local health issues, public health issues, but as it relates to guidance about crossing into the United States and coming back or other border-related issues, I think it's best to follow the advice of the federal authority on that.
Thank you. And then obviously Halloween last Sunday. Have we seen our numbers increase because of Halloween? Do we know that yet?
I haven't seen the data for the health district today, but I looked at the provincial data on Friday, and there appears to be at least some increase in the case counts. Now, can we impute that or attribute that to Halloween? I'm not sure just yet. But I think that I am a little concerned that the case counts are going up, and we should monitor that situation. The other issue is that no one data element captures the entire burden of disease, and we'll be in a better position to comment perhaps when today's local data becomes available for us to review. If you send us an email later today, we can perhaps comment on that based on today's data as well. Nicole, do you want to supplement that?
Sure. Well, I can just say our data over the weekend, so we had 61 cases. So still around the number that we are seeing on a daily basis. We reported 23 on November 6th, 27 for the 7th, and for today, 11.
Doctor, just to your point about how you're concerned with some of the trend going upwards, obviously with our numbers last week, I believe Friday was 36. Earlier in the week was a dozen, or don't have it right in front of me, but it was kind of lower. So the numbers are fluctuating. That's why you have the concerns?
Yeah, so first, I wouldn't put too much emphasis on any one data element, but we look at the broader trends, and with the broader trends, and looking at the provincial trend, I am concerned about the burden of COVID-19 on the community. I think that we have to recognize that there is always going to be some natural fluctuation in the case counts, but when the case counts exceed what we think is the natural fluctuation, we should have more concern. So let us take a fulsome look at today's data, and then we can respond to that question later on today.
Sounds good. Thank you.
Okay.
Any questions from CTV?
Yes, good morning. This might be more a question for the medical labs, but what is the difference between testing for travel and testing when individuals have symptoms?
Well, testing serves, this is a sort of a complicated issue. Testing serves a whole variety of different purposes. First thing in clinical medicine is if somebody is sick, then you want to test them to see what's the reason they're feeling sick. That's probably the most classical reasons why we might test somebody. Testing for travel is a public health strategy, or at least in part it's a public health strategy, because what one does not want, or one wants to try to mitigate, is the spread of illness from one person to another. And we know that COVID can be transmitted by people during an asymptomatic, when they don't have any symptoms. So testing can serve an individual level patient benefit, which is what we mostly use tests for. Testing can also help us manage the public health and try to mitigate the spread of illness, especially in the asymptomatic period.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Doctor, I know you said that people should follow the federal guidance on matters related to the border, but aside from that, do you have any advice for people traveling across the border today in terms of keeping themselves safe as they travel? Anything that they should be doing differently than they would be here at home?
Well, I would give general advice to prevent the spread of COVID-19, which is maintain social distancing, stay 2 meters away from other people, wear a mask indoors, wear a mask when you cannot be consistently and reliably 2 meters away from somebody else, wash your hands, minimize the number of human-to-human interactions or contacts. Those are all measures that one could do wherever they are, including traveling to another country or doing other activities. So the standard public health guidance, which I think is good guidance, is what one should engage in wherever they might be.
Thank you. And in the lead up to the border reopening, as a health unit, are you guys being contacted by people looking for information on private testing, or people may be frustrated that they can't get a travel test at the assessment center?
So we've always received calls related to testing. I think, we'll defer to the appropriate source but we do try to house as much information and make it as easy as possible for individuals to navigate. But yeah, we have always received calls as it relates to testing, understanding the various criteria, protocols as the guidance has changed, as well as, trying to help people navigate to where they can find a test for the purpose that they're seeking a test. So we do provide that information as best we can through the call center, and where needed, we'll defer to the testing centers for more information.
Thanks very much.
Any additional questions from Blackbird?
Yes, I do have a question, and it's related to another story that I'm working on, but it occurs to me that you may have something important to say about it. Over the weekend, there was a Remembrance Day ceremony in Tecumseh. One person fainted. Without getting into what all happened, is it possible that wearing a mask could cause somebody who's been standing for a long period of time still, could a mask cause them to faint?
Yeah, I don't know enough about that particular case. And in general, in the public health service, we don't comment on individual level patient phenomenon. Anything in medicine is possible, but it's always, what were the facts and circumstances based based on that. As a general construct, wearing a mask is safe. When it always is thinking about what are the chances of transmitting COVID to somebody else, and I think that wearing a mask is safe, and we use masks throughout the hospital and throughout other healthcare environments for the longest period of time. So I don't, as a general construct, I think that we can conclude that wearing a mask, using a mask is in itself safe. Now, I can't comment on that specific case because I don't know the facts and circumstances associated with that.
But generally speaking, is it possible, I guess, that a person who is standing still for about an hour and is not used to it could faint on their own with or without a mask?
Yeah, I can speak to you privately about the differential diagnosis for fainting. It's not something that you can do at a news conference, but generically, fainting has a long list of possibilities. And wearing a mask would not be anywhere at the top of that list. But not to eat up everyone else's time. If you want to talk about it privately, I'm happy to chat about the long differential diagnosis for fainting as a clinical phenomenon. And fainting is actually more complicated than one might think, because there's fainting where you remain conscious, and then there's fainting where you become unconscious, and one is called syncope. So it's complicated for sure, but I don't think that wearing a mask is a high risk event for fainting.
Okay, you know what? That answers my question perfectly. Thank you.
You're welcome.
Any question or additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
Thank you, everyone. We'll see you on Wednesday, November 10th at 8:30.
See you then.
All right.
Thank you.
All the
Bye-bye.
best. All right. Bye-bye.